Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hysteroscopy. Hysteroscopy is used to visualize the inside of the uterine cavity. While using a hysteroscopy, always use a distension media. For diagnostic purposes, the distension media used is carbon dioxide, whereas for operative hysteroscopy, we use the fluid which is either hypotonic fluid or isotonic fluid as distension media. The hypotonic fluid is the fluid which is poor in electrolytes. This includes either 5% mannitol, 3% sorbitol, or 1.5% glycine. Isotonic fluid is rich in electrolytes and it includes normal saline. The most common complication of hysteroscopy is perforation. If the perforation is in the fundal area, then we have to do observation. If the perforation is in the lateral area, then we can do immediate laparotomy, and if the perforation is in the posterior area, then we can do immediate laparotomy. The second most common complication of hysteroscopy is fluid overload. Fluid overload is reported as fluid deficit, which is due to hyponatremia resulting in cerebral edema. The media used here are if you use a hypotonic media, then a 500 ml of hypotonic media is alert. If there is 1000 ml of hypotonic media is used, then you have to stop the procedure. In isotonic media, if 1000 ml of isotonic media is used, then it is called as alert. If around 2500 ml of isotonic media is used, then you have to stop the procedure.
Because after using 1000 ml of hypotonic media and 2500 ml of isotonic media, in these conditions there can be fluid overload. So it is better to stop the procedure at that stage.
thank you and thank you for watching.